All right. Awesome. Hello, everyone. Welcome, welcome. We are waiting for everyone to join us. Welcome, everyone. We are waiting for everyone to join us. Thank you. Awesome. Wait just a minute or so for all of our participants to get online. Another minute or two. All right, welcome everyone. Thank you so much for joining us, Autism Speaks, for our Maryland COVID-19 Advocacy Update. Thank you very much. We'll obviously have a few others join us, but we're gonna just go ahead and get started. My name is Keisha James. I am the Executive Director for our National Capital Area chapter of Autism Speaks. Our chapter is over the Washington, D.C. metro area, including the state of Virginia, and of course, the great state of Maryland. And so today we are excited to partner with our advocacy team to give you an update. I also want to acknowledge on the call, Sarah Goldstein, who is our field manager in the state of Maryland and is responsible for coordinating our local programs and events in that area, and also our largest event, our Baltimore Walk. I believe Sarah's on the call and she just might want to say hello to everyone. Sarah?
Thanks, Keisha. Hi, everybody. I just wanted to say thank you for joining us. I'm really excited to see so many participants and so many people interested in this type of a webinar for the state of Maryland. I'm going to put a link in the chat box that is our local Maryland Facebook group, just so in case anybody is on Facebook and wants to join us and have some communication that way as well, that you can do that. So I'm going to drop that in there in a second, and please reach out to me if you have any questions or anything else going on in Maryland. I'm happy to talk to you. I'm happy to see everybody here. Thank you.
Thank you, Sarah. All right. And just, which is so important for us to just be reminded of our organization, Autism Speaks, and our mission, which is dedicated to promoting solutions across the spectrum and throughout the lifespan for the needs of individuals with autism and their families. And we do this through advocacy and support, increasing understanding and acceptance of people with autism, and advancing research into causes and better interventions for autism spectrum disorder and related conditions. This is one of our, advocacy is one of our greatest impact, and so we're excited to share this update with you. And I am going to turn it over to Judith Arcetti.
All right, you got it.
I got it. Thank you.
The hardest last name. Thank you, Keisha. Thank you, Sarah, too. And thank you, Maryland friends, for taking time to join us today. I know that life is chaotic right now for many of you. I know that there are self-advocates with us today. I was looking at the attendees as you all checked in, and I see some familiar names. I'm so excited to have some self-advocate friends on, fellow parents of children with autism and young adults and adults with autism. Also providers, amazing community partners are with us, and we even have folks from state agencies with us. So thank you all for taking time. It is such a challenging time, and I'm not sure if you feel this way, but no one ever gave me a handout or any sort of webinar about how to prepare for a pandemic when you're living with autism. And so I think we're all just kind of walking down this uncharted path, and it's sometimes really dark and frightening, and sometimes it's peaceful, but it's just a different time. We're all trying to make our way. So our goal today is to try to help you know that we're here for you from an advocacy perspective. We're doing our best to advocate on the federal level, as always, and on the state level too. And so we wanted to talk with you a little bit about that today. On this slide, there's actually a list of challenges that many of you could just tick off as facing over the last 7 weeks or so. I know educational services have been disrupted. Those day programs that we depend on are closed. Clinics where we access healthcare and therapy are closed. We've all shifted to telehealth, which for some is an easy shift, for others it's really hard. Mental health supports for people with autism, for parents, for siblings, for providers are needed. There's a lack of connection to the community. I know my son Jack, who's 16, and he has autism and a severe intellectual disability, counts on every Saturday going to Outback Steakhouse. And it's one of those situations where we walk in, we've been doing this for 10 years every Saturday, so they know him. They know his order, they're thrilled to see him. And that connection really feeds his soul and seems to feed theirs too. And that's just gone. You know, we can't go sit and have wings at Outback. And that may seem like a small thing to the rest of the world, but I know many of you understand how huge that is. People who rely on employment, autistic individuals, the providers who serve them, those opportunities right now are on hold. Some of them are lost. And economically, emotionally, that's so hard. Respite, where is it? Many people are going without. And when you have a 24/7 situation where someone in your life with autism needs that support and care, that can be so just exhausting and impossible. There was a story in our Georgia community recently where a mom jumped in the shower at 10 p.m. She'd been caring for her autistic son all day, and she jumped in the shower at 10 p.m. after he'd gone to bed. And while she was showering, he wandered away, and the outcome was not good. And so those kinds of stories will just break your heart and really hit home how hard things can be right now. Routines are disrupted, incomes, so many people are filing unemployment, or they have small businesses and they're not able to access loans. Then there's challenging behaviors. When people with autism are faced with all these things, one of the things that can happen is challenging behaviors, self-injurious behaviors, aggressions towards others. It's so hard. And then, of course, there's a lot of worry around access to healthcare. What if the person with autism has COVID-19 or some other medical condition and needs to access a hospital? What is that going to look like? Are they going to be able to have the appropriate supports with them? So just such a long list, and I'm sure you could add to that list. And if you have other suggestions, please put them in the chat box so we can make sure that this reflects what you're experiencing. So all these things are the things we consider when we focus on advocacy. And so today we're going to talk about advocacy. But before we do that, I want to let you know that Autism Speaks does have an autism response team that's available for you. And I know as we talk about all the issues that we're facing, that can make you think of individual circumstances that you're dealing with and make you want to reach out. Please know you can reach out to our autism response team. There's a number you can call where they are able to speak Spanish. You can email them if you prefer that, help@autismspeaks.org. So those individual questions like that might not be answered on this webinar just because of lack of time to answer all the individual ones, please make sure you reach out to the autism response team. They're there for you and they're wonderful. And we actually have some of them on the webinar too that are available to answer questions as we go. So if you have questions, put them in the Q&A or the chat and we'll be monitoring. All right, and so quickly, I will say, you already met Keisha and Sarah too. Stuart Spielman, who many of you know, he's going to be providing the federal update about what's going on in DC. I'm going to share with you about state objectives, and then we have some really helpful information from Janet Williams, who heads up community outreach for us. So without further ado, I'm going to turn this now over to the amazing Stuart Spielman, who will talk with you about our response on the federal level. Stuart, are you with us?
Yes, I am. Hi, Judah.
And
hello, fellow residents of Maryland. I'm going to talk about what the federal government has done so far. So in response to the crisis, we've seen a flurry of federal legislation. Back in the beginning of March, we saw what we refer to as COVID-1, the Coronavirus Preparedness and Response Supplemental Appropriations Bill. And this bill provides $8.3 billion in emergency funding for federal agencies to respond to the outbreak. Just a couple of weeks later, we saw a more comprehensive, far-reaching bill, which we call COVID-2, the Families First Coronavirus Response Act. And that bill provides emergency paid sick leave and family leave. There is a Q&A on the Department of Labor website if people have questions about these kinds of leave. Tax credits, free COVID-19 testing, the legislation expanded food assistance and unemployment benefits, and an increased Maryland funding. So at the end of March, there was the largest bill yet, the largest to date, actually, the Coronavirus Aid, Relief, and Economic Security Act, otherwise known as the CARES Act, not the Autism CARES Act, but the CARES Act. And this bill provides $2 trillion in funding for many provisions, including economic impact payments to most Americans, increased unemployment benefits, and hundreds of billions of dollars to address the public health response. The bill provided for a Paycheck Protection program, which probably most people on the call have heard about, to help people, help businesses retain their employees. It also provided billions of dollars for schools. I think Judith is going to talk a little bit about that later as well. And it extended an important Medicaid program called the Money Follows the Person program through November. Next slide, please. We recently had a infusion of money into the Paycheck Protection program, and this is sometimes referred to as COVID 3.5. So that program was running short of money, and so there was some additional money put in. The bill also provided funding for hospitals and testing. Right now, Congress is gathering itself and deciding on what further measures are needed. The Senate is back in session. The House is expected back next week. And we are looking at some additional legislation. How that shapes up, it's very, very difficult to say. There is a difference in philosophy between the two bodies, so we're not entirely sure what we're going to see. So there may be additional dollars for the public health response, additional economic relief for individuals and small businesses, additional dollars for state and local government, additional dollars for education, additional funding for nutritional assistance, housing assistance, funding for the Postal Service, which has taken a hit during the crisis, and infrastructure investment. Next slide, please. So we've dealt with a number of issues over the last month or so about that are related to the pandemic. There have been economic impact payments, and these payments have been relatively automatic for people who file tax returns, but there have been some issues for non-filers, and the IRS website has Q&A on how to get these payments if you haven't received one already, and answers some questions. There's been some complexity about dependence regarding these payments, and there's been discussion actually for future legislation about expanding payments for non-child dependents. Another issue is distribution of education dollars. There have been significant amounts of dollars spent on education, but of course we as a community really want to make sure that our kids are going to be able to benefit from the dollars that are flowing through to the school system. There was a great deal of controversy about waiver of the Individuals with Disability Education Act provisions. Last week, the Secretary of Education wrote to Congress and announced that she did not intend to waive provisions of IDA, which was something that we and others had pressed that she not do. We wanted to make sure that IDA remains strong and a strong protection for our community. As I indicated before, there have been discussions about emergency paid and family leave, and how those provisions affect people who are caring for individuals with autism and other disabilities. There were some technical issues initially. The Department of Labor, again, has some guidance on this that I think is fairly clear-cut. Next slide, please. So what are some of the things that we're working on here? Well, one of the things we're doing is we're holding meetings like this and trying to speak to the community about what we've been working on and hear from the community about issues of concern. So we are pressing for additional funding for home and community-based services. That is actually mentioned in a letter that the Autism Caucus co-chairs, Representatives Chris Smith of New Jersey and Representative Mike Doyle of Pennsylvania have written to the leadership. Our community needs more support to address situations like the situation that Judith referred to. Additional funding to meet educational needs of students. We have wholesale disruption. And I can tell you from as a parent of a 25-year-old who has aged out of the school system, Zoom does not work as well for my son as physical presence. So a lot of our kids are going to need to catch up, even where tele-education services are available. We have worked to protect the rights of individuals under IDEA. We want to make sure that telehealth services are available to meet the needs of our community. The economic impact payments, right now, they've been fairly limited to independents. We want to make sure that individuals, dependents who are over 17 can get those dependents, and that's going to require some further modification to the law. We have worked on emergency paid sick leave and family medical leave policy to make sure that leave is equitable. And we want to make sure that discrimination in treatment allocation is prevented. There has been some concern that people in the community might not get care simply based on their status, and we joined with a large number of other organizations to point out the importance of making sure that everyone got the care that they need. So I saw one of the questions pop up about the Smith-Doyle letter. So I'll respond to that. Representatives Chris Smith of New Jersey and Mike Doyle of Pennsylvania wrote a letter to leadership outlining important measures for our community. That letter is available on the Autism Speaks website, and we can provide a link if anyone needs it. Next slide, please. Well, I'm going to turn it over to my friend and colleague, Judith, now.
And actually, I think we might hit you with a few more questions, Stuart. Kelly Hedrick is on managing the chat. Kelly, are there any relevant questions or questions we have time to address?
Yes, there's one that we're going to save for the state section because it's relevant there, and actually a couple of those that we'll save for the state section. There's one here that's difficult to answer, but I'll share it. And Stuart, if you have any thoughts, you can add those. As the economy is cratering, how are our kids supposed to get jobs? What are you all doing to prop up programs that were just getting off the ground in the economic expansion to get people on the spectrum jobs, particularly good jobs for those that are higher functioning? So if there's any federal plans for supporting employment initiatives federally.
So, we always have conversations about jobs. This is something we have conversations about internally with our advocacy team, and beyond that. There is going to be some need for restoration and people getting back to work. And we're going to be involved with our champions in the Autism Caucus, and jobs is going to be one of the things that we look at. We're well aware that most of our community is either unemployed or underemployed, and this is something that we're going to continue to work on. The pandemic has exacerbated this crisis, and we are going to be talking about measures to bring people back.
Thanks, Stuart. The rest of the questions we'll cover at the end of Judith's section.
All right. Okay, everyone, who's ready to talk about state advocacy and what's going on there? I can feel the excitement all the way across the Zoom universe. All right, so I went through the long list of challenges that our community is facing right now. I'm sure you all have additions to that list. This is just an unprecedented hard time. So as we're focusing on what we can do in the states across the country, we've kind of focused on three things, three kind of buckets that you pull from if you're someone in the autism community to access supports and services. So of course, healthcare is a basic bucket where you're gonna get healthcare and supports. Many of you utilize waiver services, home and community-based services through DDA. And then of course, we consume education from special education, and there's early interventions. So those are kind of the three areas that we've been trying to focus in these early weeks of the pandemic to try to affect some meaningful change. So what does that mean? So I'll talk about healthcare briefly. In healthcare, you have folks that have private health insurance. It might be state or federally regulated. And then you have folks who access their health care through Medicaid. There are also people who are uninsured, unfortunately, too. With regard to Medicaid, early on during the pandemic, Seema Verma, who heads up CMS, came out and announced a lot of flexibilities with Medicaid. And one was related to what's called an 1135 waiver. And so Maryland has an 1135 waiver that they applied for with CMS, which is the federal agency that oversees Medicaid. And it just kind of makes it a little bit easier during this time to access healthcare if you're a Medicaid person. So there are provider screening requirements that are waived, deadlines for revalidations of providers are waived. It allows for certain out-of-state providers in certain settings that might not usually be allowed, suspends prior authorizations for fee-for-service, and extends existing prior authorizations. So they really try to just kind of make things a little bit easier. There is a link to the waiver if you really want to geek out. We will be providing a copy of the webinar itself, and then also a recording. So you will have access to all these links once we're through all of this. So that's the Medicaid piece. Additionally, with Medicaid, there's been a bulletin related to telehealth that applies to all the Medicaid provider types in Maryland, the managed care organizations, and Optum Behavioral Health. And so that rolled out fairly early on. The other piece of telehealth relates to private health insurance, not Medicaid, but those of you who have private health insurance that's regulated by the state of Maryland. And Governor Hogan came out on April 2nd, World Autism Awareness Day, ironically, and he authorized practitioners to participate in telehealth. And they had to do some adjustments so that people could do it not only on the phone, but also through screen, and make sure that all the HIPAA requirements were met or suspended. So that is now available too. So moving on from healthcare, let's talk about home and community-based services. Stuart talked about that a little bit earlier. One of our federal priorities is to ask for more funding for home and community-based services. It hasn't really been included in those previous packages, but it's so important to our community. For those of you who use waiver services, you might use the Maryland Autism Waiver. There are family and community waivers. All those things kind of come through DDA. So there is flexibility there through something called Appendix K. And I had never heard of Appendix K before the pandemic, but Appendix K has become exceedingly popular during this time. It's a tool that Medicaid agencies in the states can use, working with CMS to get some flexibility for those home and community-based services during a crisis like the one that we're in. You have to apply for it, and Maryland did. They have 2 different applications. I have links for those here, so it really spells out all the intricacies, all the things that were requested for Appendix K, for those waiver services. I will say one of the things that's allowed through Appendix K is pulling people off of the wait list. And so far, there have been 37 states that have applied for Appendix K relief. Only 2 of the states have asked for slots to be filled, and one of those states is Maryland. So I'm not sure how many slots they requested, but Maryland and Utah were the 2 states that actually asked to fill some waiver slots as a part of their Appendix K relief. It also allows it for other things like telehealth, personal and protective equipment reimbursement, no pre-authorization for behavioral supports, different service sites, legal guardians and relatives can be paid for more than 40 hours per week. Hours might be exceeded, things like that could really make a difference right now for families. So I will show you, when you want to find out all the things that Appendix K does in Maryland, check out this chart. I'm now going to read every square of this chart aloud to you. No, I'm not going to do that. I just wanted you to see it, and there's a link to this chart on the previous slide if you really want to go through and look at all the various waivers that Maryland has, and then all the different provisions that DDA has applied for and that have been approved through Appendix K. So those waiver services should be more flexible, but now hopefully for you. There also, I will tell you, if you go to the Maryland DDA website, they do a weekly webinar. I think it's on Fridays, I think. If you really want to geek out over this stuff and participate in those webinars, they're very interesting. Okay, so let's move on. We get to focus on all this fun stuff. Appendix K, 1135 waivers, and now we get to talk about our favorite topic, special education and early intervention. So what happens, when you can't access the school in your typical way? And in Maryland, you have public school programs, you have private programs that people are enrolled in. What does that look like? Well, we know that the Maryland Department of Education has said that they do have to recognize FAPE during this time, and they have to do their very best to provide that remotely, whatever that looks like. And so I did provide a link to you in the webinar to their guidance on this, and there's a lot of really interesting FAQs that you can look to. There are things that are good and things that aren't as good, things that we're worried about, and I think some of you have asked some questions about this. The first thing to know is, as Stuart mentioned earlier, there has been money that has come down to the state of Maryland for education generally. It's not targeted or specific to special ed, but it can be as part of what's allocated. So from COVID-3, there was $199 million that was allocated to K through 12, and that was then rolled out via a formula to districts. Post-secondary has gotten $201.6 million, and then there's this little pot of money that Governor Hogan has discretion over, $44 million. And so we're asking the governor to really think about allocating some of that $44 million to our population, to special ed. The discretionary fund is supposed to help vulnerable populations. It's supposed to address disparity. And so that definitely is our population. We're part of that group. And some of the things that we're asking him to think about is, of course, access. Do people have the hardware, the software, the tools they need to access special education? You might think of somebody out in the suburbs with a computer in every room and, Wi-Fi, and they're great. But then you think about someone else who has 4 kids, living in an apartment, 1 computer, they're all trying to participate in remote learning. What does that look like? How are people accessing? We know that school systems have been providing Wi-Fi in their parking lots, just different things like that. But we want to make sure that families have the basic tools they need. The other is we want to make sure those little ones who are coming out of early intervention are properly transitioned into special education. And if possible, we need to just hit the brakes slow that process down if it's appropriate for that individual child, and allow them more time to transition into special education. It would be very hard to do that in a traditional way right now, as we're all isolated. So that's one thing. And Betsy DeVos actually mentioned that in her report to Congress, about that it's a priority to make sure that those early intervention children don't get pushed into special education too quickly. We're also, I'm going to skip one bullet and go to the bottom bullet. At speaking about transition, we share the concern. I saw the question in the chat about people with autism who are reaching the end of their special education journey, and they need the appropriate time to transition to adulthood. So we are asking for an additional 12 months just to try to allow for planning and just the transition to adulthood that needs to occur. So that ask is a priority to us, and we think it's reasonable and it's so important. The other thing that's huge that I think many of you are facing right now, if not all of you that are in the education system, is, first of all, we know most of our teachers are doing their very best, and they are working so hard. They're being innovative, and we have a very diverse population. You've got level 1, level 2, level 3 autism spectrum disorder. It's a diverse, amazing, challenging population. How are you going to serve that population remotely? It's hard. You can't. So what we want to make sure happens is that these services that you're not getting right now are provided not 3 months from now or 6 months from now or because of some lawsuit down the road, but as soon as possible. As things open up, we would like those services to be provided. The staff back at work in whatever appropriate safe mechanism they can do that, but we're pushing for services as soon as possible. If that needs to be over the summer, so be it. But we need structure, we need access to curriculum for our population, not later, but as soon as possible. So those are the priorities, those are the things we're asking. And I'm sure you all have many other things that you'd like for us to focus on too. You can stay in touch with us, and I encourage you to do that. We have presence on Facebook, on Twitter, and also on Instagram. So please follow us on those platforms. And now I don't know if we have time for just a few questions or comments.
Yeah, Judith, just a couple.
Okay.
And they're great ones. Will Appendix K approvals end after the COVID period is over?
Yes, but in Maryland, the time that they're in place, it's till like next March. So it's out like a year. So I don't know if the state will move to try to end that earlier, but as of now, the application was for a year.
Great.
So a lot of time.
Thank you. And we have a grassroots organizer at heart asking, once we advocate for funding from Congress, will there be a letter writing campaign on the state and local levels to ensure those dollars are funneled to agencies and groups that serve the autism community?
I mean, we're actually trying to do that with our advocacy through just outreach to the agencies ourselves, but I would love to engage the grassroots too. I'm with you. So definitely, let's talk.
Great. I think that's it for now. I think everything else has been addressed verbally.
Okay, thank you, Kelly. And now we get to the really good part. So I'm gonna turn over to Janet Williams, who's gonna talk to you all about the supports and services that Autism Speaks has available right now for you during this time. So Janet, take it over.
Thank you so much, Judith. Thank you. I just want to give a shout out to our amazing advocacy team. Thank you all so much for putting this wonderful information together. My name is Janet Williams. I am Community Outreach Director. I support all of Mid-Atlantic and South Atlantic. And I just want to share with you, I'm part of the services and supports team at Autism Speaks. And just a little bit about who we are. I'm part of that team where we're out in the community providing resources, support, and help. But one of the the things that I want to mention, and you have seen some slides that talks about our amazing autism response team. And I just want to share some information about what they do, and then talk about some COVID-19 information and resources very briefly here. Now, our autism response team, they align with our mission of ensuring access to reliable information and resources. In 2019, they helped tens of thousands, through one-on-one conversations with specialists who are trained to provide information, about autism and autism-related programs and services across the lifespan. We also have an autism response guide. It contains a database that has thousands of local services and resources, some that are right in your backyard. We also have some free downloadable toolkits that are available. All of our toolkits, we have over 40 free downloadable toolkits. They're available, on our website or by contacting our autism response team. And so we're here to help with all of those tools, all of those resources to empower people with autism and their families. And I will say that since the COVID-19 pandemic hit our communities, Autism Speaks, we took a very swift action to respond, to the immediate needs of people with autism and their families. And, as we just showed you through our advocacy, through services and supports, resources, and even direct assistance. So in response to the news of the rapid spread of COVID-19 among our communities, as we just shared with you, we urged our lawmakers at the local, state, and federal level to take immediate action to protect our community. And we know that life is very, very challenging right now, and it can be especially hard for autistic people. So, all of those recent events surrounding COVID-19 and the global pandemic are forcing us to adapt. We are confronted with radical shifts in our schedules, different modes of communication. I'm sure a lot of you, like me, are kind of zoomed out right now. Social demands and safety risks. The pandemic, it's imposed adversity in the form of challenges with health, economic stability, and general well-being of people. So our resilience is determined by our ability to grow through those challenges. And so we want you to know that Autism Speaks, we're here. We're committed to supporting you and your community and the family during these trying times. So if you are in need of help or resources or even financial support, our autism response team is available to help connect you to, grant opportunities and other resources as well. So you can please contact them at 1-888-288-4762 or at help@autismspeaks.org. Thank you all so much.
Right, so there is information there for the autism response team. We've got it in there more than once because we definitely want to make sure that you all know how to reach them if necessary. And then we also, I'm going to mention too, we've got videos, I think Janet might have mentioned this too already, on our website that talk about school closures. There's another one around behavioral supports during this time, definitely worth checking out. And just another example of all the resources we have. We do have Facebook and Instagram channels, and we do have Autism Speaks Facebook groups. Sarah mentioned that earlier. There's one from Maryland that she put in the chat box. I don't know if you want to put that in there again, Sarah, but just to stay in touch with us so we can share these resources with you, or just going to our website. There is a 30-hour online video learning resource that's available. That's amazing, that we're working with an organization called Ocali to provide to you. So that's another resource that's available on the website. Also, I'll just mention quickly, and I know Janet probably already mentioned this too, but we do have lots of toolkits and information on our website. And as she mentioned that, just know that it's there. There's a transition toolkit that's amazing. The challenging behaviors toolkit, I know the day that it was introduced, our servers crashed because there's such a demand there for supports around challenging behaviors. We know our community's facing that. So we have lots of information like that available on our website for you. So just know we're here for you. I don't know if anyone has questions for Janet. She is an expert on all these things. So any questions there? Kelly?
All the questions so far have been answered. Some of them in the chat box, and referring people that have specific individual situations they would like advice on to help@autismspeaks.org. But that's it for now. We can hang in for a minute and see if there are any more questions to go into the chat or the Q&A.
Okay, no, that's wonderful. And I will just, once again, I'm going to go back to the screen with our contact info. So just stay connected with us. If you have questions too, just know we're going to email everyone after this is over with a recording, with a copy of the webinar, and the ability to reach out to us if you have a specific question. So we are here for you, and we're so grateful for your participation today. We thank all the providers and the autism nonprofits that are working so hard in Maryland to make a difference for our community. We thank our families, we thank siblings, we thank self-advocates, all of you, just for participating and for doing your best during such a challenging time. Thank you so much for joining us today, and we will be in touch soon. Take good care.
Thank you.
All right, everyone.
Good job.